Good afternoon, everyone. Today, my topic of presentation is to analyze long-term visual field fluctuation among the eyes with moderate and advanced glaucoma. As we all know, the rate of progression these eyes is very slow, and it's important to detect true change to avoid any treatment delay. So, this test-to-test variation we can which is a long-term fluctuation, we can measure it by using standard deviation, the threshold difference, or variance. Once the threshold value cross 15 to 19 decibels, it becomes difficult to detect further change because of the floor effect. So aim of our study was to calculate long-term fluctuation in patients with moderate to severe glaucoma. We have compared the eyes with progression and without progression, and we judge progression based on 10-2 PLR analysis. And we have included only threshold values which have average threshold value better than 20 decibel. So 53 eyes of 44 patients were included in this retrospective analysis. We judged progression severity of the glaucoma based on Anderson criteria, Haddox-Parrish Anderson criteria. We require minimum 5 reliable 10-2 visual field tests with minimum follow-up of 2 years. We have excluded any condition which could have affected the field test analysis. So for these are the baseline tests conducted for all the patients. So for all 68 points based on 10-2, for each point we calculated average threshold value, rate of progression including p-value, and standard deviation analysis. And we have marked the point as a progressing point if the threshold slope was worse than -1 decibel per year at p-value of 0.01. And we consider a field as a progressing even if there is a 1 point significant change. So as you can see in this diagram, the values which are marked in bold are the threshold values which were better than 20 decibels were selected. The red color values are the points which were statistically significant, and they showed higher fluctuation as compared to adjacent points. Statistical analysis was done using SPSS. So this is just to show the central view area represented the points which were taken as a central points, and rest were taken as a paracentral point. So total 13% eyes showed progression, 53% eyes were pseudophakic. When we compare the baseline parameters between eyes with progression and without progression, we did not find any difference. When we compare the baseline visual field parameter, the eyes with progression has better 10-2 mean deviation, and the rate of 10-2 MD progression was -0.59 decibel per year. So when we compare the visual field reliability indices between both the group, it was comparable. So how did we analyze fluctuations? We analyzed fluctuation based on global parameter, point-wise parameter among the eyes with and without progression. And for third group, we have just clubbed the points based on their individual characteristics such as location, rate, and presence of progression. So what we found that first two group there was no difference, and third group we found significant difference in terms of fluctuation. So when we analyze global parameters, we did not find any difference between eyes with progression and without progression. However, progressing eyes has better 10-2 MD as compared to 24-2. So when we compare the total point-wise fluctuation, we did not find any difference in terms of fluctuation. When we tried to subgroup these patient based on location of the points and rate of progression, again the both groups where median was comparable. However, when we went for the third group where we just club points together based on characteristics, the progressing point definitely showed higher threshold. They showed lesser threshold values, higher rate of progression, and the standard deviation of fluctuation was 5.24 decibels, which was higher than the stable point. So when we compare the individual point based on rate of progression, the point which have rate of progression more than 1 decibel per year, they definitely showed higher standard deviation of fluctuation, which was around 5.61 decibel, and they definitely had a higher rate of progression and depressed threshold values as compared to the other points. So when we compare these points based on location, we did not find any difference in terms of fluctuation. However, the central point showed better threshold values. So discussion, the long-term visual field fluctuation based on global and point-wise parameter didn't differ between eyes with and without progression. However, the points which have shown faster and more significant rate of progression showed higher fluctuation. So the retrospective analysis done earlier have shown that the visual field fluctuation in normal patient is around 1.65 decibel, while in advanced glaucoma it was around 2.22 decibel. In our study, we found it around 2.9 decibel. So The range of fluctuation was noted to be higher in patient with severely depressed fields as compared in the retrospective study, where they found the difference was around 2 to 5.6 decibel. So the author concluded that since the central visual field fluctuation was less than 5 decibel and the cutoff for software analysis is 10 decibel. So in our study we found that the progressing point which have shown higher fluctuation, indicating the focal nature of the disease among these eyes, which was not reflected in the global parameters. So these are my references. Thank you.
For the audio-visual, can you give one beep when there's 1 minute remaining? Because I don't think the speaker knows.
No, we don't know.
Can you
get the timing over there?
No, sir.
Can you?
इसमें तो आता है
नहीं,
लेकिन
नहीं.
इनको नहीं दिखाई देता.
Ma'am, it's not a retrospective study. We have looked into another study where we compared the progression. So we specifically wanted to look into the severe glaucoma category patient, because these are the all eyes where it was not possible to detect progression based on the routine glaucoma progression analysis. So we wanted to see whether if we can judge it by seeing if the fluctuation is more, but surprisingly we found that even the fluctuation doesn't give clue if you judge only based on the global parameters. So that means you need to go very focal in these eyes, because these eyes where a single point also means a lot to them.
Do you assume it is fluctuation compared to what? How do you know it's not progression? Because in the progression analysis, it is compared to a glaucoma of the same status, where the EMGT did 4 tests in 1 month and they found that, okay, within this is fluctuation, anything more is progression. So what did you compare your 10-2 with? How do you know it is not progression, it is fluctuation?
But because these are the patients who have been doing field tests very routinely, so we do that learning effect, all those, there is less chance of bias, subjective variation, because it's all field test is more about the functional response.
Agreed. I'm just saying, how do you know the change is not progression and it's fluctuation? Fluctuation is okay, isn't it?
Yes, but it would
progression
have.
is bad.
We have analyzed the rate of progression for individual point also, ma'am. So it should have reflected in that. We didn't go just by global parameter analysis. For each point, we have calculated the rate of progression.
Sure.
And we have used the De Moraes et al. Progression criteria.